speaker. So Villawan, oh, no. So I'll introduce Villawan, who is a registered acupuncturist and registered traditional Chinese medicine practitioner here in Ontario. She's also registered as a doctor of traditional Chinese medicine in BC. Furthermore, she is a registered pharmacist and medical doctor in Thailand. So in addition to being introduced to traditional Chinese medicine at a young age, she also employed Chinese medicine techniques to optimize her patient outcomes in an 18-year plus family medicine and dermatology practice in Thailand. So Villawan has really extensive experience and knowledge, which translates into her patients being really happy with working with her, and they always want to come back and see her. We get a lot of rave reviews about her service. So we're very honored to have Villawan as part of the team at Hillgreen, and I know that she is excited to share this information with you all today. So without further ado, I'll hand it over to.
Thank you, Pauline. Thank you for the nice introduction. Good evening, everyone. We appreciate for your presence at this event. We will present the presentation first, and then I will go with the answer afterward. The presentation today is how to manage the gastrointestinal side effect of cancer treatment from traditional Chinese medicine perspective. Actually, I learned the Chinese medicines when I was a young age. And in generally, they, because my dad, he's a Chinese doctor from China that migrated to live in Thailand. So then I observed him practice all the times since I was a kid. So we're gonna go with the, hold on 1 second. Okay, gastrointestinal side effect of cancer treatment. Factors for considerations, the side effect for the cancer treatment, it depends on the type of the treatments and medications, right? So nowadays, unlike in the past 20 years, 30 years back, there are either chemotherapy or radiation therapy. But now there are more variety choices for patients as well as for physicians to choose the medications or the modalities of the treatment for patients. And the side effect will be vary from medications to medications, right? Especially now they have more like hormonal therapy, immunotherapy, target therapy. These are newer drugs. Also depends on the dosage of treatment that given, right? If it's small dose, it's less chance. Small doses, it might be a little bit less chance to have a side effect, right? But by the way, higher dose, of course, it's going to be more chance to have a side effect. So then, because also related to how the body react to the treatment. So this is the individually, right? It varies from person to person, because some people might even small doses of the medications or radiation, they might react to the treatment quite strong. So this is vary from person to person. The common gastrointestinal side effects that I'm going to mention for today, there are constipation, diarrhea, nausea, vomiting, and etc. There are more than this, but because of our time is limited. So I'm going to bring up these 3 common things that we face almost every day when I see patients. Constipations, in general, constipation is due to the slow movement of the stool, the content inside the gastrointestinal system. And that because of the slow movements, so it increased transit time. Transit times mean the movement from the content from the stomach up to the rectum or to the anus. It's increased. So then what happened? The functions of the last intestine itself, it does the job by reabsorption the water back to the body system. So once it stayed there too long, so the water will tend to more reabsorb into the back to the body. So that's why causing the dry and hard stools. And then also we have to consider not only the slow movement of the bowel, other factors that associated with the side effect of the treatments, such as like inadequate fluid intake, opioids or sedative medications. Opioid and sedative, many people might taking not only the treatment for the cancer itself, they're also taking some other medications to help them for painkiller, for example. Opioids and sedative medications, these are well known that affect the autonomic nervous system of the body. So what happened is it's help to relax the it make the bowel system relax, not movement. So that's why the content in the gastrointestinal system gonna have more, stay longer, less peristalsis or less contraction. So the water from the content will be reabsorbed back to the body. So it is gonna be even worse for causing dry and hard stools. And other factors like vitamin and supplements, I'm quite positive that most of the cancer patients will take many supplements. And especially when I practice in Canada, I found out most of the takes many supplements for themselves. I have to keep eye on it, such as like iron, calcium, and aluminum. These three things are very common cause constipations in additional, what you're facing the side effect from other medications or radiations. And also sedentary posture. The sedentary posture, because the bowel movement or peristalsis of the gastrointestinal system will be stimulated by body activities. If you have body activities more often, then it will tend to stimulate the bowel contractions or peristalsis working better. So that's why most of my patients, I generally recommend try to do some exercise, walking around the house if possible. That's going to help to promote the bowel contraction. Depression, anxiety, insomnia. In this about the emotional factors, they stimulate the neurotransmitters. It stimulates the neurotransmitter that affect to the body, that cause constipation. For TCM perspective, okay, we looking in traditional way, right? So in popular diet, such as like a fried food, junk food, greasy food, alcohol consumption, for example, those type of diet or drinks that weaken the digestive system. The digestive system does not functions properly. So then what happened? So then they're causing, sometimes the contents stay there for long. It produces more heat inside the body. The heat. So then the water inside the contents of the digestive system will be evaporate out because of the heat and causing dryness. And the second one, the aging process or weak constitutions. These I would say all cancer patients will be under this category, like weak constitutions, right? The qi is like the energy of the body, the blood, essence, fluid deficiency in traditional Chinese medicine perspective. And then emotional instability. Sorry. Emotional instability, this factor actually affected by that is an organ that controls the energy flow throughout the body. When you have emotion instability, will be affect to that particular organ. Then what happened? So the control is not functions properly. So the energy flow will be not go to the direct to its direction. So it go to other directions. For example, like instead of the energy should be push it down, right? Push the stool down to out from the body. In fact, it's not doing the work. It's quite similar with the Western medicine. Western medicine explained by neurotransmitter, but in traditional way, we explain by functions of an organ. So what are the recommendations for constipations that we can do and help ourselves at home? Absolutely increase food intake. In general, fluid intake daily, we should have at least 2 liters or about 8 cups a day. So in people who has constipations, most of healthcare provider will recommend you to take more water because of to replace whatever reabsorbed through your large intestine, right? So then we want to have more water so that you can pass out easier. Avoid eating hot, spicy food, greasy, fried food, carbs, or sugar. As this in traditional, we believe this is can produce more heat and consume more water in the body. So that's why can cause your dryness of your stool. As the same thing, avoid alcohol consumption, coffee, tea. These are producing heat inside the body. Then stop smoking. Yes, this is also considered another heat. Increase mobility and activities, as I mentioned earlier, that the mobility will help increase or stimulate the peristalsis or the bowel contractions or gastrointestinal contractions. So then the stool should be moved faster. Increase fiber intake, such as cooked vegetable and fruits, that to help to have more bulk inside. So then you have a volume of stool. So then it can stimulate the expansions by the bulkiness of the content will also stimulate the wall of the bowel movement to have peristalsis or contractions as well. So what are home remedies that can help? We can basically start with. I'm sure most people have probably tried flax seeds, or in Chinese we call yamaju. These flax seeds, why it helps for constipations? It has a high fiber, and inside it has to be dry. Okay, you cannot. If you take the whole seed, it won't work. It has to be dry like a powder, because we want the oil. Inside they have a flax seed oil, which help to lubricate the bowel, the gastrointestinal or the bowel. So then the stool can pass out smoothly. And then prune juice. These prune juice, they have high fiber, and as well as they have a laxative effect. So quite often I recommend my patients to start with the prune juice because it's quite mild, and then it won't have a cramping, people if strong laxative or purgative, so it might have more cramped. Papaya, this, yeah, as we know, it has a high fiber, of course, because the fruits, but beside that, they have an enzyme called papain. Papain is an enzyme help for the digestive system. So then it might be for a gut health, right, beside the high fiber. Now I'm showing Thai banana is not because I'm a Thai, but actually this type of banana, if you go to Asian store, they may not call Thai banana, they might call Vietnamese banana, but it's the same thing. It's a small, but how it's different from the regular banana that we take. These banana have a very high natural magnesium and potassium. Magnesium that we know that have a laxative effect. So, and then beside that, they also have less fat and carbohydrate and carb compared to the regular banana. This banana, my mom, she's over 90, now she's over 90, 94. After walking in the morning, she had to take it at least 1 or 2 to help her constipation. Actually, she doesn't have really constipated, but it's a little bit hard come out because of her age. And also, if people knows about the aloe vera gel, inside the gel one, okay, be careful if people are going to take this one, it has to be gel. Don't contaminate with this. I think we call sap, right? The white color. When you break it out, you're going to have a white color fluid come out. So it helps for the constipations. In Asian, we even use the gel part mixed with the yogurt drink mixed together to help for constipation. And now senna leaves. I'm not sure. In Canada, do we have like a senna leaves tea bag? Sell in the supermarket or drugstore. But I found in US, yes, it's available. The senna leaves, what they have a senna, it's called sennoside, which have a purgative effect. The sennoside is the same chemical substance that contained in Senokot. Okay, people who take Senokot, they are taking sennoside. So the same action with the senna leaf. So in the past, people using, even nowadays, people misuse it to reduce their people weight by like pull out, right? And then you reduce your weight, but it's not a correct way. This is going to be a quite strong action. It's similar like a Senokot in Western. And then tamarind we use a lot in cooking. So the tamarind paste, tamarind itself is the same family with senna leaf. It's the same family, but it have a little bit it depends how much dosage you take. When we cooking, we use it, we don't use it much, right? When I recommend to patients, I use more concentrate. So then it helps have a stronger effect. So it can be used as well to help for constipation. These available in Asian supermarket, you can find it. And make a drink. Now I'm recommend for acupressure points for the constipations, such as like triple burner 6 is very, very useful, right? This is on the dorsal, on the exterior, on the dorsal part of the hand. You use the forefinger, the midline, and forefinger from your wrist down, and then you just massage it on that spot. Okay. And then the second point that I would to introduce here is we call bladder 57. It's also simple and easy too. This is on your ankle, the lateral side of your prominent bone, the lateral side, not the middle side, the lateral side to the knee cup and the middle, the midline and the middle. That's it. Then you massage it. Place on this for 20 times more often as you can. And this is help for constipations. These 2 points help for constipations. And then CV4, it's also easy, central line, 4 fingers below umbilicus. This helps to nourish the fluid, to nourish your blood and essence in the body. So then you measure 4 fingers and then massage in this area, pressures on this area. The last point that I'm going to introduce today is going to be we call CV6, halfway of CV4 from the umbilicus. This is going to help for energy flow intra-abdominal area to make it flow, you know, stimulate it flow properly or redirect it flow properly. Diarrhea, diarrhea, it generally caused by absorption and secretions of fluid in bowel are imbalanced. Generally, the people who take the medications or radiations, it might be affect the absorption rather than like secretions might be normal, right? But the absorption, because the cell lining, it has been affected by the medications. So that's why people tend to have diarrhea. Particularly radiations might be affected immediately, but for medications might be take, you know, a few sections at least to see the side effect. But most of the time radiation is quite acute because the radiation beam, it's damage to the cell immediately. The TCM perspective, similarly, it causes the digestive organ functions impairment, aging process, and weak constitutions. As I mentioned to you, like, you know, it's 1 week of constitutions, you're going to be lead to the digestive organ functions impairment as well. So this might be associated to each other, right? Instead of like fluid blood deficiency. Improper diet, right? We have to be careful, especially diarrhea. We try to avoid to eat something like, you know, difficult to digest or irritate to the digestive system. Emotional instability, same thing, because the organs that control the chi or energy movement, it's not functions properly. So that's causing the diarrhea. Recommendations for diarrhea: increase fluid intake to make sure that you have to make sure that the fluid had been replaced, right, from what you lost out from the body, and possible an electrolyte drink. In the past, especially in the Asian and remote area, what I recommend the people is like this, like boil the rice with water and they take out the liquid part and add a little bit sea salt in there, instead of, because they don't have money to buy electrolyte drink. So this can be a homemade electrolyte instead of buying, purchase, you know, the commercial brand. It's similar, function work well. Avoid dairy product and seeds, because seeds have more oil, right? So that's why we want to get rid of, like, to stimulate the bowel movement, so that the seeds should be avoided during you have a diarrhea. Avoid eating greasy fried food, raw uncooked food, because in this category, in traditional Chinese medicine, this type of foods weaken the digestive system further. So then the severity might be worse. And then the recommendations, either traditional or Western, we recommend soft diet or easy digest foods, less fiber, such as congee. Congee here I show is a very simple cook. And home remedy. Home remedies is here. I show it here, the white pony root, chow yao. The chow yao here, or white pony roots, it helps to nourish the fluid in the body. So that's why if you have some tea about it, help to replenish the fluid in the body. And licorice roots or ganchao, or maybe sometimes you take these together. On our prescriptions, sometimes we use together. This is have an effect to help stomach pain or abdominal pain as well. Besides that, nourish the fluid, replenish the fluid. And then the other one is hawthorn fruits, and hawthorn fruits or sancha. This fruit, in the past, they used to use for help for diarrhea, but recent research, it helped for the cardiovascular purpose, help to reduce cholesterol, help for the high blood pressures, and help for cardiovascular diseases. But it can help in the past history, long times back, years back, it helped for the digestive system and stop diarrhea. And then one more is white jam. This jam is help for support the digestive system, so strengthening the digestive system to work properly. Acupressure points. Acupressure point here, I bring it up for helping for actually basically help for digestive system, as well as to help for diarrhea as well. CV12, also simple again. If you look on your abdominal area from the belly button or the umbilicus, and then the bone, the sternum bone, right? And then if you move your finger a little bit to the side, you will find the lips. So then we measure from that to the umbilicus, divide by half, and then at the middle, right? And then you can use a finger, or you can just use your, the palm slowly moving, it helps. And then the second point I'm introduced here is stomach 36. How we look for the stomach 36 here. So the here, the knee cup is here, right? Then you put your 4 fingers, right? And then knee cup here and 4 finger below the knee cup. And then the 1 finger breathe away from the midline. That's it, stomach 36. The third point and introduced here is stomach 25. Also easy to, it's just the next to your belly button, right? Use 3 fingers and that's it. Draw the line and both sides. We do the both sides, left and right. And then PC6. PC6 this is gonna be on the palmar side, from the wrist downward, 3 fingers and the midline, right? Here. So, and then now the diarrhea, I'm not sure whether people had heard about the moxibustions, or we use the herbs, the mugwort leaves or artemisia leaf. This is, I'm showing this picture showing here to how they do it. This is a moxa stick. Actually, moxibustion, they have many techniques and many type of like modality how we deliver the moxa to the patients, right? This is one that patients can do at home by using moxa stick on that particular spot. Like, for example, CB12, we use around here, we use to circulate around this area for, I would say 5 to 15 minutes, depends, or stomach 36, or stomach 25, or PC6. This photo showing they're doing at the stomach 36. So the next one gonna be nausea and vomiting. The nausea and vomiting also depends on the nature of cancer, right? Either cancer in the brain or the cancer in the abdominal area. The cancer in the brain, it will be straightforward to stimulate the chemical receptor and causing nausea, vomiting. And then the cancer in abdominal area, yes, it can cause that one, cause the nausea, vomiting. And then from the cancer treatments, bowel has been slowed down or blockage because the bowel's not movement, right? The content inside the bowel itself, it keep the pressure backward, upward. So then people can feel nausea and vomiting as well. And then the other important thing is electrolyte imbalance. So that's why people who undergone with any modalities of the treatment, the doctors have to follow up blood tests regularly to see electrolyte, to see liver functions or everything. And electrolyte is one of them. They have to be that because electrolyte imbalance can cause nausea, vomiting as well. Anxiety, yes, it can cause release the neurotransmitter. So then it can cause nausea and vomiting. TCM perspective, I would say it's not, when we consider, it's almost quite similar from nausea form. It's quite similar with the diarrhea and constipation. Digestive organ function impairment, so then the movement down, it's not proper, right? And then aging process with constitution, yes, it causing the weakness of the organ function. Improper diet and food stagnation, yes. This one we have when people who have nausea and vomiting have to be more cautious about what they eat, because the food can be aggravate more, especially the food or vegetable who producing gas might be causing more. So have to be more cautious for eating those type of food or fruits or vegetable. Emotional instability, yes, the organ functions control the energy for it's not functions properly. So people can throw it out. So recommendations for nausea and vomiting. Okay, avoid overeating hot, spicy food, greasy fried foods. Of course, these type of foods are hardly to digest. So that's why it might cause more nausea and vomiting. Avoid filling stomach with large amount of liquid before eating. And then recommend to eat small meals, but more often, or sip small amount of fluids, but more often. Avoid brushing teeth just right after eating. That might be aggravate or stimulate more sensation, want to vomit. Avoid having much activity straight after eating. That might be stimulate, as we know, right? More activity can cause peristalsis or contractions of gastrointestinal system. So this might be stimulate and come out. Home remedies. First, the ginger. Ginger, this one, it's in traditional we use a lot, and in Asian we use for cooking a lot. This ginger property, many times I recommend patients to have a ginger drink. This is going to help them. In traditional, it helps to energy flow inside the abdominal area, make it smooth. So then expectingly to have less nausea and vomiting. And I have seen many cases use and quite effective with the ginger drink. And galanga, these type of herbs or spice. This galanga, actually it's a spice used cooking. I have it at home, always have to have it at home because it's a part of ingredients of my tom yum soup. So, but it helps to help the digestive system and reduce the nausea and vomiting. And white yam here is again because it helps to support and strengthening the digestive system. Peppermint, many regimen recommend to have a peppermint tea. It might, this one actually it helps to support the organs that control the energy flow. So expectingly, the flow will be smooth and go to its direction. So that's why we use a peppermint tea to help nausea and vomiting as well. Here's pineapple. I put pineapple here. There are a few things, a good way of using pineapple. One way is if a small chunk, but not eat too much. If it's too much, it's too much acidic in your stomach. It might make it worse. But small amount, like a small chunk, it might help to fresh and moist the mouth. And beside that, in the pineapple have an enzyme we call bromelain, which similar to the papain with the papaya, help for digestive system, but don't take it too much. Okay, a small amount, okay, but too much acid from the pineapple might disturb your digestive system. The tangerine peel tea, you can use it as a tea. This is going to help, very good one to help for the nausea, vomiting, direct the energy flow inside the stomach. So we use quite a lot to help for digestive system. Acupressure points here, I bring it up here. You can use similarly with the diarrhea because this helpful for nausea, vomiting, and diarrhea as well. But diarrhea instead, for nausea, vomiting, you may choose CV13 rather than 12. Where is the CV13? Very simple. After you locate the CV12, right? And then you put one finger blade above the CV12, that's a CV13. If you have the nausea, vomiting, that would be much useful compared to CV12. But if you cannot do it, you can use with CV12, it's okay too. Stomach 36, I already explained. Stomach 25. Now another point, that a new point here is kidney 27. Kidney 27, it's if you find the center of your neck and then you use three fingers according to the center of the neck and below the collarbone. That's the point, right? The clavicle or the collarbone is here and the midline is here, 3 fingers away, and that's the point below the collarbone. Both sides. Reference, questions?